Hello and welcome again to 8 Questions in 8 Minutes, a program where we ask specialists about clinical applications for dietitians. Today, we're going to focus on GI disorders. And for that, we have Danielle Gaffen with us. Danielle is a clinical dietitian. She's an expert in GI disorders, and she's going to answer 8 of our questions. Hello, Danielle, and welcome to our show.
Hello, thank you for having me.
So our first question is, what are the most effective dietary strategies for managing symptoms in patients with IBS, and how can dietitians tailor these strategies to individual patient needs?
Great question. The low FODMAP diet is currently the most effective strategy for managing IBS symptoms. And the low FODMAP diet, as you know, it reduces fermentable carbohydrates that can trigger symptoms and discomfort. And this approach significantly reduces symptoms for most people with IBS. Where the dietitian comes in is really to personalize the low FODMAP diet by guiding patients through the elimination phase and reintroduction phases. And essentially, we want to personalize and find someone's individualized food triggers. So we can help them do that and help make the recommendations practical and sustainable so that they can manage their symptoms long term.
How easy is it to personalize?
Well, it can be tricky. For example, here in America, I've worked with clients who maybe don't like to cook or aren't able to cook, maybe physically. So it really is about understanding their lifestyle in addition to finding which foods may trigger symptoms and then creating a plan that really works for the patient and have them be in the driver's seat to continue without us.
Lovely. Let's move to our second question. How can dietitians support patients with IBD, such as Crohn's disease and ulcerative colitis, through nutritional therapy during flare-ups and remissions?
That's a great question. You know, nutritional therapy for IBD can look really different during a flare-up as opposed to when a patient is feeling better and reaches remission. During a flare-up, we can recommend nutrient-dense, easily digestible foods to reduce symptoms and discomfort and prevent malnutrition. Considering there is an increased need for certain nutrients, vitamins, minerals, potentially. But during remission, when the patient is feeling better, we do want to liberalize the diet if the patient can tolerate it, and making sure the diet's balanced and making sure we can support gut health to prevent future flare-ups.
Now, a lot of the patients don't really show up once they're on remission. Do you recommend we contact them or have a certain communication with them? What's your recommendation there?
I find it can be helpful to set up sort of a longer term plan, like, hey, would you like to check in, say, in 3 months or 6 months, just to see what's going on, and sort of creating that sort of personal agreement between patient and dietitian. Then the patient knows they'll be expecting you and won't be surprised when we reach out.
It's kind of a routine there. Let's move to our third question. What are the key considerations for dietitians when advising patients with celiac disease or non-celiac gluten sensitivity, and how can they ensure adherence to a strict gluten-free diet?
Yes. As you know, strict gluten avoidance can really prevent symptoms and longer-term complications. Where I find longer-term adherence really comes into play is the education piece to really help patients read food labels or identify hidden sources of gluten, to ask the right questions to avoid cross-contamination. So really, education, whether that's through resources or support meal planning or even reading restaurant menus, really we just want to ensure they have the tools they need to do that themselves. And then, of course, regular follow-ups to make sure we're addressing any challenges that come up.
Lovely. And how percent, if you want to divide it into percent, like education and follow-up, percent-wise, how much do you think we should invest into education?
Yes, I'd say, at least in my practice, education's at least 50%, if not greater, because without that education piece, then they won't have the tools to be able to do it themselves. And, the goal of working with a patient is so that they don't need us. We want them to be able to continue long term by themselves.
Great. Let's move to our fourth question. What dietary modification can help manage GERD symptoms, and how can dietitians counsel patients on avoiding common trigger foods?
Yes. Yes, I'm so glad you brought up common trigger foods because absolutely initially with a GERD diagnosis or if symptoms are uncontrolled, we do want to help them understand what the common trigger foods are. Fatty foods, caffeine, chocolate, spicy foods, acidic foods. But ultimately, like other conditions, different people with GERD may have different triggers. So really helping them identify personal triggers through, say, a symptom food journal, or whether it's, educating on like portion control or meal timing for optimal symptom control. Those are ways that we can help them. Also, just general, in addition to food, lifestyle changes, say, for example, um, avoiding smoking or limiting alcohol, really just coming up with an overall lifestyle and plan that works for them.
Great, great. Let's move to our fifth question. What dietary interventions are most effective in managing SIBO? And how can dietitians support patients in following these recommendations?
SIBO is a tricky one because at this time, the research we have suggests that an elemental diet may benefit people with SIBO, although we do still need larger scale clinical trials to confirm this. But right now we can provide evidence-based guidance on following an elemental diet if recommended, and of course, monitoring their nutritional status. Additionally, say if someone has another diagnosed condition in addition to SIBO, for example, IBS, can be common. So, in that case, perhaps following a low FODMAP diet and seeing if high FODMAP foods do trigger symptoms for them could be helpful.
Great. Let's move to our sixth question. How can dietitians help patients identify and manage lactose intolerance or other food intolerances? And what alternatives can they suggest to ensure adequate nutrition?
While there are some tests that do identify intolerances like lactose intolerance, specifically where a dietitian can come in is helping patients use a symptom food journal to really track the foods they're consuming, the beverages they're consuming, as well as associated symptoms. So once we help them identify an intolerance, then we can recommend suitable alternatives. For example, like dairy-free products, plant-based products, or even like enzyme supplements to really help them help ensure adequate nutrition and minimize symptoms. And of course, in the process, just making sure that if there are any intolerances, if whole food groups need to be, considered or limited, that we make sure we're providing guidance on having a balanced diet.
And how accurate are those exams or tests that we use for the intolerances? Any comments there?
Yes, some tests are much more accurate than others. So definitely with any type of test you recommend, make sure it's evidence-based recommendations and, of course, make someone's healthcare team, doctor and so forth, aware of the recommendation and have them do the test for you so you know it's legitimate.
Yeah, so there is some sort of collaboration needed there.
Definitely.
Let's go to our seventh question. How should dietitians approach fiber intake in patients with various GI disorders, considering the balance between soluble and insoluble fiber?
Yes, I'm so glad you made the distinction there because especially in GI conditions, focusing more on soluble, at least at first, may be better tolerated than insoluble, depending on the condition. For example, like soluble fiber, that can help manage diarrhea and may be easier to tolerate. Whereas insoluble fiber can absolutely alleviate constipation and maybe something good too. Both types are good for the gut, good for nourishing those beneficial bacteria in the gut microbiome. So it really is, focusing on the individual's diagnosed health condition and, of course, their symptoms, seeing what their diet already is before you start working with them, and then you can ensure you can make appropriate recommendations that will help them and do it in a way that won't exacerbate symptoms.
Lovely, lovely. Let's move to our eighth question. What are the nutritional considerations and strategies for patients undergoing GI surgery, such as the bariatric surgery or bowel resection, to support recovery and long-term health?
Yes. So important, because nutritional considerations for patients undergoing GI surgeries, they change a lot, depending on what's going on. So for sure, for healing after a surgery, ensuring adequate protein intake is a must. But also we want to make sure that we can manage any potential micronutrient deficiencies that could happen after surgery. And depending where the gastrointestinal surgery is, different nutrients may be more important to consider than others. After someone is healed, though, I think what's really important longer term, if you're working with a patient longer term, or at least give them a game plan to follow once they are healed, really to promote the reintroduction of foods in a way that they can tolerate, just to make sure they're able to digest those foods and can also return to a normal quality of life eating and minimize chances of potential complications like malabsorption or dumping syndrome, depending on what's going on.
Lovely, lovely. All right, thank you very much, Danielle, for your input on GI disorders, and we'll hope to see you very soon in the Middle East on our in-person trainings. Until then, all the best and take care. Bye-bye.
Very welcome. Bye.